At the Rwanda COVID-19 Treatment Center in Kigali, specialized doctors and nurses are taking care of each patient in critical units separately. On one hand, some of the patients who had healed from the virus are still in critical conditions due to its effects such as respiratory complications, lung failures, high blood pressure and others. They are currently on critical care ventilators. Some of these patients say even though they no longer take COVID-19 treatments, they are currently struggling with other diseases that were as a result of the virus. They are warning people to take COVID-19 preventive measures seriously. I had totally healed from the virus along with the pains. Apart from the respiratory complications, I was off the medications. I would advise all people to take COVID-19 seriously because it's real and it's growing stronger. There are side effects, although there may not be many, but they are present. Despite the fact that one has eventually been tested negative. For example, I'm having respiratory problems, which could improve with the change of location. Otherwise, COVID-19 is real and people need to take it seriously. Many cases have been reported of patients that had healed from the virus and shortly after they passed away from other diseases. The head of the Rwanda COVID-19 Treatment Center and also in charge of treating patients in the critical unit, Dr. Françoise Xavier, says that people who delay themselves to receive treatment for COVID-19 virus risk suffering from respiratory diseases afterwards. Lungs are vital to the human body, hence when they are damaged, the normal air we breathe is no longer able to circulate the rest of the organs, and in some cases, even the oxygen we provide to the patients fails to circulate in the blood. Sometimes it depends with the patient's timing for them to heal. Some patients will fail to breathe from our machines because their lungs are extremely damaged, hence very few are able to survive. Officials at the Rwanda Biomedical Center say the effects of COVID-19 after healing are in three parts: physical effects on the body, lung failure, which usually result to death due to patients receiving treatment late, and psychological effects, which could include the brain aging by as much as 10 years. Some patients stay on oxygen supply for a long time, even after healing from the virus. These patients stay at the hospital for further treatments, and some others with extensively damaged lungs eventually pass away. There are also psychological effects, whereby in the research we carried out in Nyarugenge, Kirehe and Rusizi district, 60% of the patients had side effects of depression, insomnia and constant fatigue. We have related these side effects with the research that was carried out in foreign countries, which showed that after healing COVID-19 virus, one's brain can age by as much as 10 years. RBC says research is being carried out in order to find out the total number of people across the country that have healed from COVID-19 but experienced other side effects. The aim is to provide special treatment for those types of patients. Mutoni reporting for RTV.